Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do only faces. I operate from here to here, and I don't do boobs, bellies, or butts. I'm a double-boarded surgeon. I'm a teacher, and I'm an author. So I really love talking about cosmetic surgery. And recently, I've had a couple. Um, so I have about 25 million views on my YouTube. And I talk to patients that aren't even my patients. Maybe they've had surgery and they have a question or a problem. And I've had several questions about having firmness under your chin, what we call the submental area, after facelift surgery. And patients say, I had facelift 3 weeks ago, and I have these hard areas under my chin. So I want to talk about that. Basically, when we do a deep plane face and neck lift, which is my passion, I love doing this, and we're making an incision here at the beginning of the case, and we're dissecting a little bit of the skin away, and then we are doing something to the muscles, trimming the digastric muscles, trimming the platysma, sometimes trimming submandibular glands. So we're doing a lot of work in this very small area. And then we suture it up and you go to the next part and do that and finish the surgery. So what happens when you trim muscle in other tissues? You get inflammation. Myositis is an inflammation of the muscles, and they kind of swell and get firm. Also, fluid can accumulate in this area. And if blood or fluid accumulates, that's also an irritant. And, if you have a squishy thing under there after facelift surgery, we'll usually suck that out with a needle. And also, you don't want to be holding your head in this position a lot after surgery because it makes little ringlets, and you get stasis or settling of the inflammatory fluids in those areas, and that can also add to firmness. Okay, so number one, it's not unusual to have firmness several weeks after you have a face and neck lift, and that will soften up over time. Now, what do we do to expedite that? Well, we inject anti-inflammatory um, medications in there, 5-fluorouracil or Kenalog, and that takes away the inflammation, and that really helps. Also, massage, and we do ultrasound in our office where you have a little ultrasound machine, delivers deep heat. So those conservative therapies will help. And quite honestly, it would probably go away by itself if you didn't do anything. But to make that heal quicker, that's what we do. If you are worried about anything, you should always talk to your surgeon. If you don't have a surgeon yet, I'm Dr. Joe Niamtu in Richmond, Virginia. LoveThatFace.com. We'd love to hear from you. Thank you so much for your time. Have a great day.